peer-to-peer meeting. Hopefully everybody was able to get outside on Sunday or Monday because it looks like it's going to be cold and windy the next few days, but hold on to your hats. We'll get to Easter and it'll be beautiful again. So I'm Terry Orr with Child Care Resource and Referral. I'm a child care consultant on the Decorah office, and I'd like to welcome everybody to our peer-to-peer meeting. Just a few little housekeeping items. It looks like everybody's on mute. If you could kind of just remain that way, that really helps so we don't have any feedback. There is a chat box function. If you go down to the bottom, there's a little chat box that you can always enter your questions at any time. We will probably get to those at the end. And of course, if there's opportunity that you would like to unmute and ask a question, we'll certainly be open to that as well. And we really want to be respectful to everybody's time. So we're hoping to wrap up by 2 o'clock too. And with any meeting that we have, if you have questions and we don't get to them, we will certainly get to you at some point after the meeting. And we are recording this. So with that, I just want to make sure that everybody knows that we are excited to have Heidi Hotvedt come back and join us again. I think it's been a little while before we've had her join us. She is the Healthy Child Care Iowa coordinator and a child care nurse consultant, and she is going to take it away.
Thanks, Terry and Esther. Thanks for having me again today. I'm going to go ahead and share my screen and we'll get started. I just wanted to share my contact information. Like I said, thank you for having me on today. And if you have any questions, after this presentation, you can always reach me at the email address at Iowa Department of Public Health. You can call and leave a message, or you can always, of course, share with CCR&R and they can share them with me. So just because sometimes I think, after the meeting, then you think, oh, I should ask this, or I had this one question that came up. So I just wanted to make sure you had all my contact information. The first thing I want to just cover is about COVID-19 vaccination. So I'm sure all of you are aware of this, but I'm just going to do a little quick overview. So Iowa child care providers are included in the one of the top priorities. Okay, so many of you have already received your vaccination, but just wanted to share some resources and some additional information. So, we do know that getting vaccinated as soon as the opportunity is available is an important way for you and your staff to stay safe and reduce the risk of getting seriously ill from COVID. There is, I know we've had a lot of challenges somewhat across the state with kind of finding a site that's doing vaccination, but there is a vaccination locator, and the link is right there, vaccinateiowa.gov, but maybe Esther can put that in the chat real quick. So you can go by zip code and put in that information to look for availability in your area. Other resources, of course, reach out to CCR&R, to your child care nurse consultant locally, and then to local public health. I know, you're all from Region 2, but a lot of the local public health offices are helping to coordinate. You can look at their website. I know they get kind of bombarded with phone calls, so trying to look at their website first is really the best way to see what's available. And sometimes they will still have a link there for additional information or a contact me button so that you can email questions. I know many child care programs have had the opportunity already, like I said, to be vaccinated or have been reached out, via email or contact from local public health to get those vaccinations completed for you and your staff. The CDC just came out with a really great vaccine toolkit specifically for schools and childcare programs. And in the corner, in the right-hand corner, there's kind of a poster there. So there's some really great posters, fact sheets, and some infographics that are available to you to download and print and post. And I think that that's really important because, especially just kind of sharing information about that you're encouraging vaccination so that families can see that. And then, having the fact sheets available for staff if they have questions or concerns. They have some great kind of those general, information overview, but also there is a frequently asked questions about COVID vaccination on the website at the CDC. And that's really helpful because it goes through some of those common things that keep coming up in terms of questions from different staff, and parents and just the general population, as well as some information about some myths versus some facts about vaccination. So some really great resources. And like I said, if you have a chance to look at that toolkit, that would just be such a great opportunity for you to get some more information for your staff and for yourself. I just want to share, we know that all of the COVID-19 vaccines that are currently available in the United States have been shown, demonstrated to be highly effective at preventing COVID-19. And we know that getting vaccinated yourself may also protect people around you, especially those at higher risk for illness. And at this point, children are not able to be vaccinated. They're in testing mode right now for children. But we do know that 16 and above can be vaccinated. But children are a risk group because they are not able to be vaccinated. So us being vaccinated around children can be helpful to help build protection, and then also to help stop the pandemic. Just so you know, one of the other benefits is that people who have been in close contact with someone who has had COVID-19 are not required to quarantine if they're fully vaccinated and are not showing symptoms. So that's a big change. And that's some information that was specifically on our new childcare guidance document, and we'll talk about that a little bit more. But so that if you are fully vaccinated, which means 2 weeks from your final dose of the COVID vaccine, so if that's a 1 dose or a 2 dose, 2 weeks out, they say that you're fully vaccinated and you are not required to quarantine if you have a close contact with someone. And then, of course, we're just going to continue to practice mitigation efforts, because even, we do know that there's going to be a large population of people that are vaccinated or have had the disease themselves. But we do know that there are going to be individuals who either, they can't get vaccinated because they have, a medical condition that doesn't allow them to be able to be vaccinated, or they're too young to be vaccinated, or they have concerns about the vaccine and they choose not to get vaccinated. So we know that, and that's okay, because we're really looking for herd immunity, and herd immunity is when we have enough people in the community that have been vaccinated and have protection against the disease. And so we want to continue to practice those mitigation efforts, like wearing a face covering or a mask, having social distancing with those outside of your household, washing your hands with soap and water, and then, of course, staying home when you're sick. So I'll just jump right into the updated guidance documents that were just posted. Both the child care guidance, the DHS IDPH guidance document was updated and posted. You probably received an email from CCR&R, a constant contact, about that. And if you haven't seen those yet, we're going to talk a little bit about them, but they are posted so that you can see them on the DHS website. Healthy Childcare Iowa has it on their website, and CCR&R has it on their website. So you can go ahead and look at both of those guidance documents. So they were both updated on 3/24, and so they were updated to reflect some of the changes on the CDC guidance for operating childcare during COVID-19, and that was updated on 3/12. So that's another great resource for you to look at some more specific information. But we're going to cover some of the high points and a lot of the common questions that I seem to receive, or our local nurse consultants receive, regarding specific ideas, specific concerns, or things that have been in the guidance document or in the CDC guidance. The two things that really I just want to draw your attention to is that there is information on both vaccination and quarantine guidance, so that's kind of a big one. And then, like I said, all three of our websites have the posted documents, so they are. Sometimes it's hard to find things. We know that, so we try to make sure that things are posted so that you have the most current information. And I would say keeping track of those dates are really important, because sometimes when I get a phone call, I'll have someone who say, well, I'm looking at the child care guidance and this is what it says. And I'll say, well, what date is it? So kind of keeping idea when those dates change, we want to use the most current guidance document. So both the outbreak responsibilities and the child care guidance are dated 3/24 or March 24th, 2021. So there's 2 links that are in the updated guidance document, and those are some links from the CDC that they developed some new infographics, one for specifically for centers and one for homes. And the links are there, maybe those are, and they're also linked also in the guidance document. So it's a really great visual for programs that are trying to look at kind of their mitigation strategies and putting some things in place. And so I really like these because I think they're visual and they kind of show what we're talking about. But the first page, as you can see in the corner, this is just an example of the center one. And it kind of has a diagram of the center and the mitigation efforts that you would put into place. And then the second page actually explains each one of the bullets. So, or the numbered items, or the lettered items. So it's really a great tool. And if you haven't seen those already, like I said, they're linked to the CDC guidance or to the child care guidance document. A couple of things I want to go through a few things that are changes or new information that are part of the child care guidance document. So this is something that was added on the CDC website, and I wouldn't say that it's new information, but it's some information that was kind of in several different areas, and now it's just kind of all in one category, and it was specific to children with disabilities and special health needs. And so that was added to the child care guidance document, that heading, and just overall, we know wearing masks may be difficult for young children with certain disabilities, whether that be a visual or a hearing impairment, or those with sensory issues or behavioral issues. So we just want, you might need to make an accommodation for that child because it's just not working for them to wear a mask. Of course, we encourage mask wearing for children 2 years of age and older, but we know that there's going to be children that are unable to wear a mask, and that's okay. And you just want to make sure that you've had that communication with the parents, that that's something that you've tried, or you would encourage them to try at home. But if it's not working for the individual child, we do want to make accommodations for that. The other thing we want to make sure is that therapists or early intervention specialists, or anyone that's kind of working with the child, speech therapy, physical therapy, maybe someone from the AEA coming in. We want to make sure that your facility is providing those important services for children with special health needs. So allowing them access into the building is important, and we really want to safeguard them also. I mean, we want to follow those mitigation strategies of doing those health checks, and having them sign in. That's all great, great protocol to have into place. But and then we want to make sure too to space things out. So if you could limit the interaction of the specialist to only the children or the child that they're seeing, and then really kind of think about that social distancing and how can you make that work in the classroom setting. That can be challenging, and so we know that. So just think about your facility or your home environment and how you can space things out to be able to allow those services that children do need to be able to take place. And then if you have any questions or concerns, you can always reach out to your local CCNC to assist with care planning or to assist with kind of those spacing issues, because that is a concern, and just for some extra guidance and some help with those. The next thing I just wanted to cover, and this is actually not necessarily any new information, but I just thought it would be important because it seems to be something that we get a lot of questions about. And it's about the whole physical distancing and drop off and pick up and stuff for parents. So we definitely want to stagger use and restrict the number of people allowed in common areas and make sure that everyone can have 6 feet spacing. So That's part of the challenge, I know, with pickup and drop off for parents, because you kind of have that communal space or that hallway, or maybe kind of in the entry area of the child care program, or maybe you have some, um, areas where they're, hanging coats up, or there's cubbies or different things like that. And that can be a little congested. And then that's the challenge with the spacing. So we want to make sure that you're trying to work through those things. But I do get this question a lot, is that DHS, is DHS still saying that, we can't have parents into the building? And that is not in the guidance document. We just have that guidance that they really need to be thinking of their facility or their home, and then how they can stagger or kind of restrict that. And that might include where you put tape on the floor to kind of mark out that 6 feet. Trying to encourage, of course, encourage parents to be wearing a mask when they enter the building. Some programs, it works best to have drop off, out the door, and that's fine too. It all depends on what works best for your program, and just trying to look at those mitigation strategies and put them into practice that works best for your program. Really grouping children and staff to make and having them be static, so that the same children and the same staff are together, and that there's limited mixing of groups. That is really best for kind of keeping, if you have a classroom and you can separate those groups into kind of 2 groups, within the same classroom, and separate those groups into assigned to a staff person, and having the table set apart, when they're doing their center time, changing your schedule a little bit in terms of circle time, or some of those activities where all kids are together. So just really thinking strategically is, how can I keep those groups kind of static and not intermixing? And the reason is because we know children don't always wear masks appropriately, and then younger children, of course, aren't able to wear masks. So we are just trying to do some prevention, so that we don't end up when there is a positive case, that caused some challenges because of quarantine. We do want to just really state too, it's important to allow mothers who are breastfeeding to meet their nutritional needs of their infants. And we know that space is a challenge. So just consider those space options to support the breastfeeding mom. And that may be, it might not work to have it, I know some programs where they maybe have, a space kind of in their room that's a little bit of a quiet space that's in the corner, where it's a place where, mom, can breastfeed when she first comes to pick up, or when she's dropping off. That might not work as well, because we need to be spacing people, and we need to not have maybe that might not work as well in your space. So maybe consider, what other options do we have that we can still support mom with their infant. I'm just going to keep going unless there's any questions that have come up in the chat that I should just address right now.
There is one question. Why is it still 6 feet when schools are going to 3 feet?
So our current guidance document is 6 feet, and that could change. Just like we're being flexible, but the guidance from the CDC is still 6 feet. That may change. I know there's some studies that they're looking at regarding, is it 6 feet? Can it be 3 feet? But at this time, the guidance document says 6 feet, and that's what CDC is. We're following what the CDC guidance is. Great question. Any other ones right now, or I'll just keep going?
That's it now.
Okay, great. We get a lot of questions about toys and bedding and art supplies and manipulatives. So I just wanted to cover a few things on this. So I guess the one thing I just want to say is clean bedding that touches the child's skin, that washing of that bedding should be weekly. I know there was at one time it was daily. It's recommended weekly, or before use if it's going to be with another child. So that's really talking about bedding. The challenge that we still come across is like dress-up clothes and some of the soft items and some of the things that we can't use disinfectant sprays on. And we really want to discourage sharing of those items. So, think about your program and think about, could you have a dress-up day where, all the kids bring something that they're going to take, dress up in. but it's theirs and they're not going to share it with other children. Or, if you're, have some dress up clothes maybe in the kitchen area, and you have, see if there's somebody in your, parent group, or in maybe some of, in your local community that could sew some aprons so each child could have their own apron. Some of those things where we have to think a little differently, so that we're limiting that sharing. And because we really want to make sure that we're not, having children kind of sharing those items. And part of that reason is because we know that children, don't, always wear their mask appropriately, or they have a hard time keeping their mask in place. And children tend to touch their mask a lot. Actually, I will say most adults touch their mask a lot. If you are watching TV or seeing anybody just out in public, it seems like people tend to adjust their mask a lot of times because it's a poor fit, but sometimes that just happens. And so you're doing a lot of touching of your face. And of course, that's where those, that there's a potential for the virus spread that way. So, so we just want to limit those. Definitely, think about your supplies and see, what can you do to minimize the sharing of high touch materials, so, if you're, just from being on site, I know, there's a whole bin of Hot Wheel cars. Maybe we need to just think about, could we separate those Hot Wheel cars into little small baskets where each child kind of has their own set, or each group of kids. So if you're doing more grouping cohorts, maybe you could have them share just in that cohort group, but not in the whole classroom. So when you think about, different stations or centers that you've set up, if you're doing markers, rather than having the big basket of markers, I know one program had mentioned that what they did is they bought little pencil boxes, the ones that they could easily clean and disinfect. And so they had each child have their own, Play-Doh, they had their own markers in there. They had the things that they could use during art time and some of their creative time, but it was their items rather than a shared basket on the table. So just thinking about that and seeing if you could do that. I'd say some of the manipulatives, that's another thing, is really thinking of, how can I separate things out so that we're not doing a lot of sharing of those items. And then, if you are doing some sharing, with supplies or equipment, that, if it's used by one group at a time, and then clean and disinfect between use.
Heidi, we do just have someone who, I know you touched on this a little bit, but like, is it a good idea at all then to bring any items from home? They were just asking that question, I think also as a comment as well.
Yeah, I think that, there isn't specific guidance that says that they can't bring anything from home. I just think sometimes it's hard because it's the whole, cleaning, disinfecting of those items. And so I think each program needs to evaluate how that will work for them. So, I know that initially we had said, really limit those items, bring them from home, limit things, but as we've kind of moved forward, we're just saying to really think about cleaning and disinfecting, and really those challenged items that can't be cleaned and disinfected is what we can do with those to limit that. So good question. For outdoor space, this was some information that, now that we're going into spring and summer, yay, outdoor space does help to reduce the spread of COVID-19. So that's great. The CDC put that in the guidance document. We still want to take preventative measures, but they were saying, some different things about, if feasible, have children and staff eat outdoors and physical distance. We can do picnic time or use, benches, or bring the classroom outdoors. I know there's a lot of great trainings available on the iPower website specifically about bringing your classroom outdoors into the outdoor environment. And I was recently on site on a playground, not when children were present, but observing how their classroom was laid out. And they had a lot of opportunities for outdoor time in different kind of stations, in terms of like a music station, and they had kind of an area where they could do their circle time with books and things, and do a reading opportunity. And so just some different shade structures and some different layouts of really utilizing their outdoor space. And I think that's a great, great mitigation effort and a great idea. We do get a lot of questions about cleaning and disinfecting of the outdoor areas. And so CDC was very clear again is to really just target the use of disinfectants for those high touch, hard surfaces touched by multiple children, like the handrails, like the picnic bench, like, those areas where, if you're doing meals outdoors, and they're at the picnic benches, those would be the ones that you would be cleaning and disinfecting, and not your whole playground equipment, because it's just it's expensive, and we know it's a really challenge sometimes to get some of our supplies. So we really want to just not use those disinfectants in those ways, but to just use the targeted use of the disinfectant on those high touch surfaces. And then ventilation also is some information that I just wanted to touch on, and this is kind of my last area that I was going to touch on. That's for the child care guidance and the CDC. And I just wanted to talk about that, with ventilation, we really want to think about how can we improve ventilation by opening windows, using child safe fans. It's a good way to increase airflow, and increasing airflow can help from COVID particles from staying concentrated in one place. So, now that we're moving into weather where we could possibly get some outdoor air in, that's really a good thing to think about. There's a specific guidance document about, it's called CDC ventilation in schools and childcare programs. And so the link's in there. We have to think about safety. Please think about safety. In some programs, it's not going to work. But they are even saying, if you put a stop lock on the window and it can only open up, if you just open up a small amount of your window space, even that little bit can help with ventilation in your classrooms. So every window is a little bit different. That's something that you can work with your CCR&R consultant or your nurse consultant on, specifically how it would work for your program. Even if you can't open windows, they say, using a child safe fan can really just help with ventilation. And then probably the biggest thing is that if you haven't had your HVAC system looked at, a lot of HVAC systems do have a system where you can bring in more outside air into your system rather than circulating the same air. And so that's where you'd want to talk with a professional about that. But that's another approach, is to really look at those air filtration and how much fresh outside air you're bringing into your system. I think I saw a chat pop up.
I put that in the chat. No questions.
Oh, okay.
You're doing a good job.
Great. So that's kind of it that I was going to talk about with the child care guidance. And so, like I said, both guidance documents were updated, and go through that guidance document. And if you have questions, that's a great opportunity to reach out to your child care nurse consultant, your CCR&R consultant, or to myself if there's specific, questions that you're not sure about. They did include some links in both of the guidance document, because we're still following the guidance around if individuals are wearing masks, how do you identify that close contact? Do they need to quarantine? There's information specifically in the child care guidance about not required quarantine if the close contact has been fully vaccinated, or if the close contact, if you're in a close contact with a positive case, but you have had COVID in the last, if you're in your 3-month period or your 90 days of when you had the infection, that you don't need to quarantine. So there's some, and every situation is so unique. So I think it's really, sometimes when you're having those questions, reach out to your local nurse consultant, reach out to me. We can kind of help walk through that, because I know, I think everybody's doing such a great job. I will just tell you, I've been so impressed with how all of the child care programs, centers, and homes have handled kind of these situations where you have a positive case, and then you're trying to figure out, who do you need to send home, and who needs to isolate, who needs to quarantine. And so there's a lot of just trying to look through that and work through that, and we're here to help. But that is changed and was included in the child care guidance document, as well as, of course, the case reporting document. So I'm gonna just jump ahead into children with seasonal allergies and asthma, because we've been having a lot of questions about this, and I thought this was a really helpful kind of a diagram. But we do know, it's allergy season right now. A lot of things are in bloom, and so we have it's a challenge because we have kind of our symptoms of COVID, we have symptoms of allergies, a lot of them overlap, but I think really this is a good diagram, just kind of explaining, there's some symptoms of COVID, and then there's some symptoms that are common to both, but definitely there's some symptoms that are specific to allergies or to seasonal allergies. And usually the itchy, watery eyes and the sneezing are really kind of key when it's allergies, because those are not symptoms of COVID-19. Okay, neither of those. And we know that children have mild illness, so then it's really tricky. A lot of times they may not run a fever. They may just have the cough, or they may just have the congestion and the runny nose. We've had a lot of that, and so that's really challenging, because that, of course, is also seasonal allergies. So really thinking about kind of what is the allergy, or what is the child having for their their symptoms, and then evaluating that, doing those daily health checks for symptoms and asking those questions of parents. And then, if they have documentation of seasonal allergies in their health record, and that, and this is, the parent says, they started with kind of the watery, itchy eyes, we're back on our allergy medication that we always take this time of year, they also have a cough, so, then you have to kind of discern or figure out, is this what's going on, and then we can always encourage testing. I mean, to be on the safe side, if a child has symptoms of COVID, and this has not changed, if a child or an adult has symptoms of COVID-19 and they test and it's negative, then they can return, once they're fever-free 24 hours. And if they didn't have a fever, they can return, right away. So as soon as you get that negative test. So we're following that. We've been following that. That hasn't changed. It's been months of that guidance. So, we want to encourage testing. And I know that there's some families that, choose not to test. And so if they choose not to test and they have symptoms of maybe allergies, that they have symptoms that you're just not sure what it is. They have the cough, they have the congestion, they had the sore throat for one day, maybe they even had a temperature over the weekend, then we need to follow our guidance document that says that they should be excluded from care because they're having symptoms of COVID. So I think that's a challenge. I know, very challenging for programs, very challenging for parents, but we do want to just continue to encourage testing so that we know. I know I've talked about this before, but I want to just bring this back up because we've had some children with asthma, and I've had quite a few questions on this, and I've come across this already too. We do know that people with moderate to severe asthma can be at higher risk for illness with COVID-19. And so we want to make sure that the child's asthma action plan is in place. So if you don't have an asthma action plan and the child has asthma, the child takes an inhaler, it takes asthma meds, we want to make sure that they have an asthma action plan that's been developed and signed by the physician in place. And if you need help with that, your local nurse consultant can help obtain that or work with the parent to obtain that. We do know disinfectants can trigger an asthma attack. So that is a huge concern. We're using a lot more disinfectants. I mean, we've always been really good about cleaning and disinfecting and sanitizing in the childcare environment. You guys have always been great at that. But we do know that there are some disinfectants that can trigger an asthma attack, and we know bleach specifically as an asthmagen, and so it's a trigger. And I know a lot of programs have changed over to bleach products because they were having a hard time getting other products. So just so you know that, and then, really help children avoid asthma triggers. and talk with your local nurse consultant if you have a staff member or a child who has triggers to bleach and you're trying to figure out what to use instead. Because I do know that we've had that question come up, and we've had it with staff too, where they cannot be in the classroom when bleach is being sprayed. Well, we know that the disinfectant needs to be sprayed, you know, in the classroom setting. So that's where just want to make sure that you know that that's a resource, is to contact your nurse consultant to kind of help up through that. And then the last thing on asthma is about nebulizer treatment, and that has not changed. We really are saying that nebulizers should not be done in the child care setting at this time. This is an at this time. There's still really limited data about if doing a nebulizer treatment, and if the child did have COVID and you weren't aware of it, maybe they were asymptomatic, would that be an aerosol generated procedure, and that could cause potentially infectious disease spread. So the CDC is still recommending that parents talk with their healthcare provider to order an inhaler with a spacer to be used at childcare. And we normally don't do that with infants and small children. You know, normally infants especially use a nebulizer treatment, but at this time they're just saying that you know, an inhaler with a spacer can be used effectively in younger children, and to talk with their healthcare provider about that.
Heidi, we do have a couple questions. We have one that says, what if a doctor says they don't need to test because the doctor doesn't believe it is COVID? And then a comment that says, I know a doctor that says a child can have an ear infection and COVID at the same time. So your thoughts and comments about those two pieces?
Yeah, we do that. We do know that children, and I mean adults, but children, they do have some research that they do have more common to have co-infection with COVID. So they have strep and they have COVID, you know, so the sore throat, you know, they have both, or you know, they have the ear infection, they also have COVID. So common with co-infection, and there's some research on that. So you know, it's hard because when you refer a child to a healthcare provider, and you know, we can encourage testing, but I think sometimes you know, that puts us in a challenging position, because you have a policy of exclusion and you have a guidance document and information specific around COVID and exclusion. And then when the child is seen by, you know, by their physician, and maybe they're diagnosed with the ear infection, and the physician says, well, it's an ear infection and they can return, you know, back into care. And we don't know if they, you know, they haven't been tested, and say they've, you know, been running the fever, they've had the other symptoms. And so, you know, you do know the children that are in care, and you do know your children and who has chronic illnesses. And so it's really, you know, working with the parent and with the healthcare provider, but it is your exclusion policy. And so following best practice, exclusion would be following the COVID exclusion if they're not tested, which I know that's challenging to say that, but I'm just being honest. That is, it is your exclusion policy, and you can follow, you know, the guidance that we have in place. Good questions. Just wanted to show real quick, you know, our Healthy Childcare Iowa website. We actually put our COVID section in the printed products tab. So if you go on our website and you click on the printed products tab, you'll see things alphabetized in there. This is where we have a lot of our guidance documents. And then we have a COVID-19 section with some specific links to those areas that are the common questions that we get about specific to childcare. And then also we have the health and safety guidance documents posted there from IDPH DHS guidance. So just wanted to share that with you. And then also we have links to DHS and to CCR&R on our website. So sometimes it's just hard to find things. And then of course, on our Healthy Childcare Iowa website, we also have our map. So, you know, if you haven't looked at our map for a while, we've had some changes. We've had some staff changes in Region 2. So I would encourage you to go on the consultant map. You can go on just the regular website and find a consultant, or go on to the consultant tab and click on find a consultant, and then it'll bring up the map, and then the number associates with the nurse consultant that's local to your area, so and the coverage counties. And then we have some time, I think, for questions.
There is nothing in the chat right now. I did put some links in there. So if anyone wants to raise their hand or pop in the chat or unmute yourself, please go right ahead. This is your chance to.
I have a
I'll
question.
stop sharing right now too, so we can just take questions. Thank you.
I have a question. I haven't really had a chance to read the childcare guidance very much, but
Okay.
there was one thing that says at least 20 days have passed since symptoms first appeared, or they have 2 negative tests in a row, 24 hours apart. Can you explain that part to me?
Just, so are you in the guidance of specifically in the quarantine guidance?
Let's see. It is in the page, let's see, page 3 of the quarantine guidance. Yes.
Okay. So in the new guidance, you know, we go to the kind of the quarantine, the CDC quarantine, and I know that there's some specific information around if a person has is immunocompromised because of disease process or treatment. So that's I would have to look that up, but I think that's kind of that 20 days, I think is what you're referring to. But our current guidance document does not have specific information about that. So you're probably thinking about the last guidance document. I'll have to
Nope,
pull it out.
this is the brand new one that I clicked on it through my email that just came out.
Yeah. So in our that's specific. The 20 days have passed is with severe or advanced immunosuppression.
Okay.
Yep.
Thank you.
Yeah, good question. I know it's a lot of change, a lot of things to like look at and read through. I did have I've heard some really positive things and just been able to actually be out in the field some and really have been super impressed with how kids seem to be doing, and adults, but kids with their masks, wearing masks in care. I don't know if anybody has anything to share about that, but I've been, you know, really, it's been great to see how well that's adapted. I think how our kids have adapted to that.
Feel free to unmute yourself. Just so you all know too, if you think of a question later on, we can always forward that on to Heidi, or you can share that with her contact information. If you have any other questions that are not COVID related or comments, please feel free to use this time as well. But since we do have Heidi, this is a great time for those health and safety questions, especially regarding COVID and our new guidance document. I mean, maybe this is a good sign.
I don't know.
We will not, in respect to everybody's time, we can end early. There's no reason why we need to sit on just for the sake of time here. I'm gonna do one last call out for questions. If it's on the tip of your tongue, this is it, guys, to ask. But we just want to say from Child Care Resource and Referral, and I know from our nurse consultants and DHS, thank you so much to all of our childcare providers for the amazing work you continue to do. There's not enough days of the year that we could give thanks continually, because you guys have been amazing this past year. So thank you. One more time, guys. Any questions, comments?
Esty, there's one question that came up in the chat.
Okay.
Maybe you can unmute and just kind of the question was any change in staffing and essential workers. And so I was just wondering specifically about that, if you want to unmute and just ask that question.
Yeah, like in the past, it was if your staff shortage and you kind of had you maybe could come back sooner, or if you weren't showing symptoms. I didn't see anything kind of thing specifically about essential workers and staff shortages this time.
Yeah, so there's some, you kind of have to go through some of that, those specifics in those situations. We still do have the opportunity, and it doesn't work always, but to do a shortened quarantine. So I know that is something that is still in the guidance document, or at least in the CDC link. So those shortened quarantine, and then for staff, looking at kind of that staffing information and where you're at. And that's where I would just say too, if you're trying to work through that and figure out, sometimes it's just, rather than trying to search through the guidance and figure out where that language is, reach out to your nurse consultant and have them kind of help walk you through that. There is, on the IDPH website, there's some specific guidance document too, and there's actually some information that has kind of an infographic about that. So there's some resources out there, but rather than having to, if you're having a hard time finding that specific information, just reach out to your local nurse consultant for that specific. Good question. Well, I think I'll go ahead and end for my part. So thanks again for having me on, and then thank you. We are just so appreciative of all of the work that you have been doing. I know it's not easy. The mitigation strategies are challenging, but you're doing such a great job, and really supporting families and children in care. Just really appreciative of that. So thank you for all you do.
Thank you very much, Heidi, for joining us, and thank you everybody else for joining us today. We appreciate your time. We have recorded this and we will send it out later. And as always, if you have questions, don't be afraid to reach out to your child care nurse consultant or child care resource referral, and we'll definitely get your questions answered. I'm sure we will schedule another one of these events down the road. And if you ever have ideas that you would like to have addressed at one of these meetings, we'd be happy to help you with that. So thanks everyone, and have a lovely Easter.